It is common to find men at the Kenyan coast dressed in a leso, a fabric wrapped around the waist. And perhaps that is why it has been easy for Pekeshe Kadenge to conceal some extra weight he has carried around his private parts for the past 18 years. We meet the 75-year-old at his Mbararani home in Kenya's Kilifi County.
Mguu wangu unanitatiza kabisa. Siwezi kabisa kwenda safari ndefu. Mwaka huu ni wa 18. Siwezi kutembea vizuri. Ninamaliza miezi 3 hapa nyumbani.
The nature of his condition makes it much harder to seek medical attention at public hospitals.
Ikaanza mguu mmoja tu, karibu miaka 4 ndio ikachanganyikana miguu mbili. Lakini sikuzaliwa nayo. Sasa kila mwaka serikali wananiletea. Sijui tembe ine ninakula lakini kaifaulu kabisa.
Mr. Kadenge is suffering from elephantiasis of the scrotum, private but not rare at the Kenyan coast. Elephantiasis is a neglected tropical disease transmitted by mosquitoes. Although the disease can be prevented, it has no cure, and access to treatment is often hampered by stigma and poor health infrastructure. About 3 million people are at risk of infection. The most visible part of this disease is the swelling of the legs, but there are also people like Mr. Kadenge who suffer from both the swelling of the legs and sexual organs.
Ilianza baridi kabisa, na kwa hata kutembea siwezi kutembea. Nikijaribu kulima naendelea kidogo alafu nishindwe.
Available treatment includes an operation for the cases of the scrotum or amputation for the legs. A visit to the county government to see what plans are in place to prevent more people from contracting the disease doesn't yield much.
There is an issue, problem with elephantiasis, and mostly in Kwale, pockets of Malindi, and the vicinity within Malindi. I must say it is being handled as any other disease in terms of what I would say is management of the disease.
The county is still waiting for a new study to take action, despite the existence of numerous studies that are gathering dust on government shelves. Meanwhile, Pekeshe's condition has gotten worse in the last 2 years. Both legs are swelling.
Lakini kianzwa ni mguu. Hapa mlefika, nimemaliza vilelo ni viwili, vitatu ya maji. Maji tukula, chakula sitaki kabisa. Ikitoka chakula hii nikiona namna hii natapika ile maji. Halafu nataka maji ya kunywa, ndio chakula yangu. Hata kama ni wiki itamaliza. Sitaki simu.
His local government is yet to prioritize elephantiasis in its budgeting, despite being the least spending county in the coastal region, where the disease is most endemic. Mr. Kadenge's county has not allocated any money to specifically fight elephantiasis in its over 300 million health development budget. Kilifi County is spending 255 shillings in developing health services on him this year. This is 6 times less than what its neighboring Lamu County has set aside to spend on each of its citizens.
I have put research directly under my docket, and there are various already areas that I've identified as of priority, and elephantiasis is one of them.
As the county waits for this new report, thousands of residents of Kilifi County remain at risk of infection, the first stage in what becomes a lifelong burden.
Bibi ndiye anahangaika na wale wajukuu wangu na watoto wangu. Sijiwezi kabisa, niko kwa baridi tu kukaa. Bibi ndiye anazunguka na kujanipatia chakula hapa. Sina la kufanya.